A warm welcome to Conceptual Learning. Today we are going to learn about brachial plexus, one of the important topic in anatomy first year in BPS. Brachial plexus. What do you mean by brachial plexus? It is the anterior primary rami of C5 to T1 spinal nerves. First of all, we have to understand that what is anterior primary rami. Every spinal nerve has a dorsal root and a ventral root. This is the dorsal root and a ventral root. In the dorsal root there is a dorsal root ganglion. This is the dorsal root ganglion. The dorsal root and the ventral root joins to form the spinal nerve. Then it splits into a anterior primary rami and dorsal rami, or ventral rami or dorsal rami. This is the anterior primary rami, this is the anterior primary rami, and this is the posterior rami of a spinal nerve. Coming to the knot, if the contribution of C4 is large and that of the T2 is absent, it is called prefixed brachial plexus. The contribution of C4 is large and that from the T2 is absent, it is prefixed. If the contribution of C4 is absent and that from the T2 is present, it is postfixed. Coming to the components, there are 4 components for a brachial plexus, which include root, trunk, divisions and cords. The root and trunk is located in the neck, division is located behind the clavicle, and cords is located in the axilla. Coming detail to the root, trunk, division, cords. Root is formed by the anterior primary rami of C5 to T1 spinal nerves. The trunk, C5 and C6 roots joins to form the upper trunk. C7 continues as middle trunk. Z8 and T1 becomes the lower trunk. Division. Each trunk divides into anterior and posterior division. Cords. The anterior division of upper trunk and the middle trunk joins to form the lateral cord. Anterior division of lower trunk forms the medial cord, and posterior division of three trunks joins to form the posterior cord. We have studied about the roots. These are the roots C5, Z6, C7, C8 and T1. These roots are the anterior primary rami of C5 to T1 spinal nerves. We have studied about the trunk. This is the upper trunk which is formed by the Z5 and Z6. C5 and C6 joins to form the upper trunk. C7 continues as middle trunk, and the Z8 and T1 anterior primary rami of spinal nerves joins to form the lower trunk. Each trunk has a anterior division and a posterior division. The anterior division of upper trunk and the middle trunk joins to form the lateral cord. The anterior division of upper trunk and the middle trunk joins to form the lateral cord. Coming to the medial cord, in the medial cord, the anterior division of lower trunk continues as medial cord. This is the medial cord. The anterior division of lower trunk continues as medial cord. The posterior division of all three trunks. This is the upper trunk posterior division, middle trunk posterior division. This is the lower trunk posterior division joins to form the posterior cord. Now we are going to study the branches from each components. From roots, there is long thoracic nerve. This is a long thoracic nerve and dorsal scapular nerve. there is a root value C5, C6 and C7 for long thoracic nerve and C5 for dorsal scapular nerve. Trunk, there is upper trunk. From upper trunk there is two branches, suprascapular nerve and nerve to subclavius, which is having a root value of C5 and C6. From cords there are three cords. There is lateral cord, medial cord and posterior cord. From the lateral cord there is three branches which is having a mnemonic, which is lateral pectoral nerve and LLM. This is the mnemonic for lateral cord. L for lateral pectoral nerve, next L for the lateral root of median nerve and the M for musculocutaneous nerve. From medial cord, for medial cord there is a mnemonic, that is M for U. The M for U, the four M's represents the four branches, which is medial pectoral nerve, medial root of median nerve, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, and U for ulnar nerve. U for ulnar nerve. From the posterior cord, there is five branches. The five branches having a mnemonic of ulnar. The U for upper subscapular nerve, L for lower subscapular nerve, N for nerve to subclavius or thoracodorsal nerve. This is the nerve to subclavius, nerve to latissimus dorsi, or thoracodorsal nerve represents the N. This is the third letter in the mnemonic. Ulnar, third letter. And A for axillary nerve and R for radial nerve. Now we can correlate this with the picture and study the root value. Correlating with the picture, from root there is two branches. Dorsal scapular branch, which is having a root value of C5 since it is coming from the C5 root. And there is a long thoracic nerve. This is the long thoracic nerve. This one is the long thoracic nerve, which is having a root value of C5, C6 and C7. This is the long thoracic nerve. And coming to the branches from the trunk. From the trunk there is suprascapular nerve and nerve to subclavius. Both are coming from the upper trunk. Since the upper trunk is formed by the joining of C5 and C6, both having a root value of C5 and C6. Coming to the lateral cord. We have a mnemonic, which is LLM. L for lateral pectoral nerve and another L for lateral root of median nerve and another L for musculocutaneous nerve, which is the continuation of lateral cord. For lateral cord there is lateral pectoral nerve and musculocutaneous nerve and lateral root of median nerve, which comes under the mnemonic LLM. And since the lateral cord is formed by the upper trunk and the middle trunk, upper trunk is formed by the joining of C5 and C6 and middle trunk is formed by the C7, continuation of C7. Therefore, all the branches from the lateral cord, this is the lateral cord, all the branches from the lateral cord, that is LLM, having a root value of C5, C6 and C7. Coming to the medial cord. There is one difference. Only for ulnar nerve there is a difference. Medial cord is formed by the anterior division of the lower trunk. The lower trunk continues as anterior division continues as medial cord. Therefore, all the branches except ulnar nerve having the root value of C8 and T1 from which the lower trunk is formed. This is the lower trunk. And it is formed by the joining of C8 and T1. Therefore, all the branches except ulnar having a root value of C8 and T1. The branches from the medial cord having a mnemonic of M4U. Medial pectoral nerve, 4 M's are medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and the medial root of median nerve. Lastly, the U represents the ulnar nerve, which is having the exceptional root value, that is along with C8 and T1, ulnar nerve having a root value of C7 also. Therefore, all other branches of the medial cord having a root value C8 and T1, and except ulnar nerve having a root value of C7, C8 and T1. Coming to the posterior cord. Posterior cord is the most exceptional root value case in this brachial plexus. In the posterior cord, we have to by heart the root value. Posterior cord having a branches from the posterior cord, the mnemonic is ulnar. First there is upper subscapular nerve, which is having a root value of C5 and C6, and lower subscapular, this is the lower subscapular nerve, this is the lower subscapular nerve, which is having a root value of same C5 and C6. Upper subscapular and lower subscapular having a root value of C5 and C6. Between them there is a nerve, that is thoracodorsal nerve having a root value of C6, C7 and C8. And there is axillary nerve, and radial nerve, which is the terminating branches of the posterior cord. And this axillary nerve have a root value of C5 and C6. That is axillary nerve, upper subscapular, lower subscapular having a root value of C5 and C6. Thoracodorsal having a root value of C6, C7 and C8. Radial nerve have a root value of C8, C5 to T1. It is having a root value of C5 to T1. Okay, you have to by heart the root value of all the branches from the posterior cord. The branches from the posterior cord is upper subscapular, lower subscapular, thoracodorsal nerve, which is the nerve to latissimus dorsi, and axillary nerve and radial nerve. This is a knot regarding the brachial plexus. C5 and C6 roots joins to form the middle upper trunk, and it divides in the anterior posterior division. And the upper trunk gives up two branches, suprascapular nerve and nerve to subclavius. The point where all the six divisions, all the six nerves joins is called Mbbs point. The six nerves are C5, C6 roots, suprascapular nerve and nerve to subclavius, and anterior posterior division from the upper trunk.